Have you ever seen a girl sitting quietly, holding her stomach, trying to smile, while silently suffering? Have you ever been told, "It's normal, just tolerate it, every girl goes through this"? But what if I told you, not everything about your period is normal, and more importantly, you don't have to suffer in silence? Today, we are breaking that silence. And this video is not just for women, it is for men too, because menstruation is not just a women's issue, it is a human issue. Understanding it creates empathy, and empathy creates support. Menstruation begins at menarche, the first period, usually between 9 to 15 years of age, and continues every month until menopause, usually between 45 to 55 years, when periods permanently stop. Between these two stages, your body speaks to you every month. Pain, irregular cycles, heavy bleeding, discharge, mood changes. The question is, are you listening? Dysmenorrhea, painful periods. In simple words, this means painful periods. In Hindi, it is called kashtatav or dardnak mahavari. In Konkani, it is mashikahem vedna or periodaho dukh. This pain is usually due to strong uterine contractions caused by chemicals called prostaglandins. Sometimes, it can also be due to conditions like endometriosis or uterine fibroids. Mira, a 17-year-old girl, used to miss school every month because of severe cramps. She believed this was normal, but when she started walking daily, using a hot water bag, improving her sleep, and reducing junk food, her pain reduced significantly within a few months. Pain may be common, but suffering is not necessary. Scientific evidence shows that simple measures work. Heat therapy relaxes uterine muscles. Regular exercise improves blood flow and reduces inflammation. Painkillers like ibuprofen or mefenamic acid reduce prostaglandin production. These medicines are generally safe if taken correctly after food and within recommended doses. Many people ask, can I take painkillers every month? The answer is yes. But if pain is severe or worsening, you must seek medical advice. Now let's talk about something very commonly asked, calcium. Calcium helps regulate muscle contraction. Since the uterus is a muscle, adequate calcium may reduce cramps. Studies show that around 1,200 milligrams per day may reduce pain and PMS symptoms, especially when combined with vitamin D. But calcium is not a cure. It does not replace proper treatment, and it does not treat conditions like endometriosis. You can also support your body with simple herbal remedies. Warm ginger tea, fennel water, or cinnamon tea may help reduce cramps by improving blood flow. Chamomile or peppermint tea may help relax the mind and reduce mild discomfort. These are supportive, not replacements for treatment. PMS, premenstrual syndrome. Many women experience symptoms a few days before their period. These include mood swings, irritability, bloating, breast tenderness, headache, and fatigue. These happen due to hormonal changes. Regular exercise, good sleep, reducing caffeine, and a balanced diet can help. Studies show calcium and vitamin D may reduce PMS symptoms, especially mood changes. A common question is it normal to feel emotional before periods? Yes, mild mood changes are common, but if symptoms are severe and affect daily life, medical help may be needed. Amenorrhea, missed periods. In Hindi, this is anartav, and in Konkani, masik nayanam. This means absence of periods. Common causes include stress, weight changes, excessive exercise, and hormonal issues like polycystic ovary syndrome, and thyroid problems like thyroid disease. Aisha, a student, stopped getting her periods during exam stress. Once she improved her sleep and diet, her cycles returned. Yes, stress alone can stop periods. Menorrhagia, heavy bleeding, in Hindi, atiraktasrav, and in Konkani, faar raktienem. This means excessive bleeding. If you are soaking a pad every hour, that is not normal and needs medical attention. Iron-rich foods and hydration are important to prevent weakness and anemia. Other disorders include menorrhagia, which is bleeding between periods, polymenorrhea, meaning too frequent periods, oligomenorrhea, where periods are infrequent, and heteromenorrhea, where cycles are irregular and unpredictable, leucorrhoea, white discharge. In Hindi, shwet prada, and in Konkani, pandrostrav, normal discharge is clear or white without smell. If there is itching, foul smell, or discomfort, it may indicate infection. Maintaining hygiene and including probiotics like curd or buttermilk in your diet helps maintain healthy vaginal flora. When should you visit a doctor? You should not ignore symptoms like severe pain, increasing pain, heavy bleeding, irregular cycles, or foul-smelling discharge. Investigations. Doctors may advise tests like hemoglobin to check anemia, thyroid tests, ultrasound, and hormonal tests depending on your symptoms. Preventing complications. Early treatment, regular exercise, balanced nutrition, and stress management can prevent long-term problems. Avoiding absenteeism. Many girls miss school or work due to period pain, but this can be managed. Track your cycle. Start medication early. Carry a period kit with pads, medicines, and a heat patch. Stay active instead of complete bed rest. You do not have to miss your life because of your period. Menstrual hygiene. Good hygiene is essential. Change pads every 4 to 6 hours. Wash hands before and after. Keep the area clean and dry. Advanced practices include wiping from front to back, using cotton underwear, and sun-drying garments. Avoid using deodorants, scented washes, or strong soaps in the perineal area. These disturb the natural protective bacteria and pH, increasing the risk of infection. Plain water is the safest method for routine cleaning. Many people ask if intimate washes should be used daily. The answer is no. Overuse can do more harm than good. Menstrual cup. Menstrual cups are safe, cost-effective, and eco-friendly. They can last for 5 to 10 years and can be used for 8 to 12 hours at a time. They reduce odor and rashes compared to pads. However, they require proper cleaning and may take time to learn. Role of men. This is important. Men should also understand menstruation. If your sister is in pain, help her. If your wife is tired, support her. If your friend is struggling, be understanding. Awareness creates empathy, and empathy creates care. Myths. Many people believe that you should not bathe during periods, but in reality, bathing improves hygiene and reduces cramps. Some think exercise is harmful, but moderate exercise actually reduces pain. Many believe white discharge means weakness, but it is often a normal physiological process. Some think irregular periods are always normal, but persistent irregularity needs evaluation. There is also a myth that menstrual cups affect virginity, which is scientifically incorrect. Final message. If your body is speaking to you every month, why are you not listening? Pain is a signal. Irregular cycles are a signal. Heavy bleeding is a signal. Your body is not weak. It is communicating. And when you understand it, you take control of your health. Let us stop normalizing suffering. Let us start understanding. Let us start supporting. Because menstrual health is not just about periods, it is about dignity, awareness, and care. And sometimes, one conversation can change a life.